So first applied is the most common, that is the laryngitis. So laryngitis is the edema of the vocal cords caused due to the excessive shouting or due to the defective dietary habits. So that may lead to the laryngitis. It may be infective or non-infective type of the laryngitis. So the main complaint of the patient is the hoarseness of the voice or exertional phonation, or there is a loss of voice sometime. As the edema subsides, then the phonation returns. So here the ENT people will see the vocal cords from the laryngeal inlet, that is called the laryngoscope, and the process is called the laryngoscopy. It may be direct or the indirect laryngoscopy. And here the vocal cords are swollen because of the edema. So laryngitis is that condition. Another condition which is related to is the singer's node. So singer's node are present to the professional singers. They have the insurance of their vocal cords in millions and trillions, because their whole of the earning depend upon the two vocal cords. In these cases, the excessive shouting by the politicians or by the housewives or by the professionals, it lead to the formation of a very small nodule on the vocal cord, on the medial border, and it is because of the submucosal hemorrhage. So submucosal hemorrhage lead to the hematoma formation. Maybe it is very small and minute, but voice is altered, and patient notice it and then came to the physician. So they are small, they are called the singer's node. The treatment is surgical, and the operation is called SMR, submucosal resection. We do not cut and remove the node from the medial border of the cricovocal membrane, because if we remove from here, it will lead to the post-operative scar formation, and the condition will be aggravated. So we all know that the superior surface of the cricovocal membrane has got a loose mucous membrane. So loose mucous membrane is already there. So we lift this mucous membrane and we cut here, and from here we put an instrument and we remove the node like this. So we have gone below the mucosa. So operation called the sub, means below the mucosal operation. Another condition related to the larynx is the cancer of the larynx. It is usually in the age of 60 and 70 years, and it is of three types: supraglottic, glottic, and infraglottic. As we know, the laryngeal inlet, the vestibule formed by the epiglottis, the vestibular fold formed by the lower end of the quadrangular membrane. This is the sinus of the larynx. Then this is the vocal folds, and this is the mucous membrane covering the inside the trachea. So here lies the cricovocal membrane, the vocal cords, and here lies the lower end of the quadrangular membrane, that is called vestibular fold. So this part between the vestibular fold and vocal fold is called the glottis. Above this area is called the supraglottic part, and below this is the infraglottic part of the laryngeal cavity, lined by the ciliated columnar epithelium. So the tumor, cancerous tumor, may arise from the mucous membrane or the muscles overlying them. So if the tumor is supraglottic type, so this is the vestibule, a large area space is there, so the tumor can grow without any obstruction. And these cancer cases, they are reported very, very late. When the growth has reached the third or fourth stage, then the patient got. Then when it is large enough and reaches the other side, then patient has got the respiratory difficulty. Dyspnea will be there. When the growth is small, patient doesn't have got any problem of the respiration. Vocal cord, they are also not affected, so patient can also speak also. So there is no any voice disturbance and no respiratory problem. Only in the late stages, when it reaches the opposite side, patient come with the complaint of dyspnea. But still patient can speak because of the vocal cord is not involved. So they are the supraglottic. Second is the glottic part. So whenever there is any growth in the sinus, here is there, or here also. So here also there is no respiratory problem, no vocal problem. But if the vocal cords, they are involved, then the patient may have got the voice disturbance. The phonation is affected, and patient consult the physician. Third is the infraglottic. So infraglottic tumors, they involve the vocal cords earlier, and patient come early, and cancer is detected earlier. But these growths, they go downward into the trachea, and the trachea is very much spacious. So even in the early stages, because of the ample space of the trachea, these cancer growth, they grow very rapidly. No doubt they are detected earlier, but till the patient reaches, the growth is too much. So this is how we divide the parts of the glottic, supraglottic and the infraglottic. Another applied is the endotracheal intubation. So in the endotracheal intubation, what happens? Patients lying on the ventilator, as these cases in the corona nowadays, or whenever we give the anesthesia, general anesthesia for any operation on the human body. So patient is lying unconscious on the operation table by the anesthetic agents, the injections. So during the surgery, which may prolong for 4 hours, 3 hours, 6 hours, so on that period of the time of the operation, we give the artificial oxygen supply to the patient, or in other words, we are put the patient on the ventilator, even in the operation theater also. For that, a special tube is available in the market, which is called the endotracheal tube. So this is a rubber tube is available. The upper end of the rubber tube is fitted with the oxygen supply. It is also fitted with the air entry, and it is also provided with the removal of the secretions, because these mucosa, it also contains mucus producing cells. There are also serous cells also. So watery fluid is also present to make the voice. The surface is moist because of these serous and the mucous gland, embedded with the ciliated columnar epithelium. So this tube is introduced from the oral cavity. So it goes into the oropharynx, and from here it goes behind the epiglottis, and here it comes in the laryngeal inlet. So this tube is quite long tube, starting from outside the oral cavity and going into the trachea just above the bifurcation at the level of T4. And this tube is now put in the reaches the trachea before it is bifurcated into right and left principal bronchus. And here we put the air into it. A balloon comes out of the outer surface of this endotracheal tube. Balloon is already embedded in the tube. So when we inflate the air, this balloon goes up, and now this endotracheal tube cannot be removed because of the obstruction caused due to this. So they pass through the vocal cords. So during intubation, patient can't speak, even he becomes conscious, because of it touches the vocal cords, and the vibration of vocal cord is obstructed because of this tube. So this whole procedure is called the endotracheal intubation. So when the operation is over, then we remove the air from the hair, and the tube is removed safely. So this procedure is also performed in the larynx. After finishing with the larynx, we start with the new chapter that is called the last part of the head and neck, is the pharynx.